coming to MRI and CT in 2022. So what we see today that the clinician is completely surrounded by different types of MRIs and different types of CTs, and there's definitely a lot of confusion as to where they should align themselves to get a good diagnosis and service for their patients. So at the outset, I would just like to ask a simple question, like, are all 1.5 Tesla MRI machines the same? Because that has become kind of a benchmark, and we feel that when we say 1.5 Tesla, that all 1.5 Teslas are the same. So the answer is, we just find out. Now let me give a common example of another machinery that we use every day. And I hope you don't mind if I can just compare 3 different cars. So all our cars, all our 4 tires, all move from one place to the other. But are the 4 cars the same? No. So the answer is all 1.5 Tesla MRI machines are not the same. So as we can see that there is something written here, and probably I've spoken about it a few times. That is a 18 channel 1.5 Tesla. So channel are basically hardware components in the MRI system, and they play a very huge role in the kind of images that we can obtain. And actually, when I went for my fellowship to New York University, that is the place where I saw this machine for the first time. And definitely it was almost like love at first sight, and I thought that if it's so good, why shouldn't we have it here in the city of Thane? And that is why in the year 2012 we finally got this at Talav, Pali. So one striking thing is that we are seeing at the MRI machine from the side now, and what we can see that the bore is just 150 centimeters, that is just 5 feet. And because of that, a patient who is lying down in the MRI, the width-wise feels a very open feeling, and it is almost like a open MRI, and that makes a lot of difference, because if the patient is comfortable and can enable a scan to be done without movement, then we can get some great information. Also, it is possible to scan in the feet first position, so that for all the scans from the hip downwards, the feet get into the MRI machine, and The patient can literally even be in the MRI, get the scan done, and even chat with his relative without moving. So what we see here is an antenna which is used at so many places by security forces, by police. So what we see, the black portion is the antenna of the walkie-talkie, and that receives the signal. So similarly in the MRI we have coils that receive the signal. So we have coils for different areas of the body, like this is the knee coil, and these are really beautiful. These are flex coils. So these are extremely lightweight and they are very flexible. So they can just be put on the body part and be turned over the patient and are very comfortable for the patient. And this is of course a spine coil which is integrated within the table. So if a patient has to do a lumbar spine MRI, we don't need to apply any coil from outside because this coil is on the table of the MRI. So why are we talking about these coils? Because these coils have inherent elements inside them, and the MRI machine itself has channels. So if the number of elements matches with the number of channels in the MRI system, then we get great images. So for example, if the knee coil which we saw had suppose 14 elements and it was only an 8-channel system, then there is a mismatch of 6. So if we have an 18-channel system, then the 14 elements of the coil match with the 14 channels of the machine, and that gives us much better images. This is one thing which probably has not been spoken as far as MRI is concerned, and that's homogeneity. The homogeneity of the magnetic field which is generated by the MRI machine plays a great role in obtaining great images. And I'm very happy to say that the homogeneity of the specific model of 1.5 Tesla at SunScan, which is Avanto, is one of the highest in the industry. This is a simple example to make us understand what does homogeneity mean. Now, if you see this cube, on the top of that, there are colors which are different, and therefore definitely this is not homogeneous. And as compared to this, at the top of the cube is all yellow. That means this is homogeneous. So this is a very simple example just to highlight that. And why do we need such a homogeneous magnetic field? Because we need to have very high resolution. And is it really necessary? Let's find out. Again, one more example. On the left hand side, you can see that there is this flower with a bee, and if you can try and compare it with the right hand side, you can see that right hand side is much more sharper, much more clearer. This is just an example of a proof sequence which is obtained while a person is talking. So we can see the movement of the tongue, of the epiglottis, of the lips. And this is just a trained volunteer. So it may be actually difficult for a patient to do this. But this is just to show how well even these things can be picked up. And of course the resolution is important because we need to pick up small things like this acute infarct, which is almost like a pinpoint size, is very well picked up, which is bright on the diffusion and is dark on the ADC. Again, resolution is important in patients with trigeminal neuralgia who have very severe pain going along their ear and mandible and even along the inner side of the mouth, and where there is a vascular loop that is compressing the trigeminal nerve, where we take images almost as thin as half a millimeter, and it is only possible when we can take such high resolution thin images. Great MR angiograms are possible now, and we can see that there are very tiny 2 millimeter areas which are seen here in the internal carotid artery, which are labeled in the red, and these are very small aneurysms. So it has been possible even to pick up such small aneurysms. And high resolution is also important in everyday practice, where even a simple thing like a backache where you get such a disc, it is important to see whether it's a ruptured disc, whether the disc has fragment has migrated anywhere, because the operating surgeon needs all this information. And of course, in smaller anatomical areas like the wrist, where we are seeing structures like the TFCC or the triangular fibrocartilage complex, again we have to do as thin as this. Now, many patients with this kind of injuries can get conserved, but if it is a tear of the main substance of the TFCC, then they may need a surgery. And very good homogeneity enables us to do accurate MR spectroscopy. Now, this is a very interesting case, and this was done just at the beginning of the pandemic, and this is getting published in an international journal. And this patient only had a cranial nerve palsy, and if you see that there is a lesion right in the area of the pons, do all of us see it? And if you see that there are 3 different sequences here and in different planes, and that is the strength of MRI, that every lesion can be seen in different sequences, and that helps us to characterize that. So we can see that the lesion has a bright signal on the first image, so that could either be a hemorrhage or a calcification. In the middle image as well as in the last image, again the same area is dark. Now the last image is a gradient image which can show a bleed or calcification as dark. So it is a rim of either hemorrhage or calcification. Now giving contrast, if you can see the central image, you can see that the lesion is actually compressing the brainstem and to a very large extent. And the last image is a subtracted image. That is, when we first do a plane scan, then we do a contrast scan, then we subtract the plane scan from the contrast scan to actually see how much enhancement is there. So the enhancement is very minimal, as we can see here. Again, a very good example of how resolution can help us. Now these are 2 mm high resolution images. Now if you can see that dark line which is pointed out with a red arrow, that is actually the basilar artery. So if you see that the posterior aspect of the basilar artery is not really seen well. So obviously what would a radiologist do? You do a MR angiogram to see whether the basilar artery is really seen. And what do we see? The basilar artery is not really visualized. So let us compare a normal MR angiogram, and we can see that the normal basilar artery is seen, whereas in this case, the basilar artery was absent. So what was this? This was a huge thrombosed basilar artery aneurysm compressing the brainstem. Of course, resolution is of great value in joints because it can not only help us to diagnose meniscal tears, but also characterize, like this example of flap tear, where the arthroscopic surgeon would be very happy to know before intervening what exactly needs to be done. Now this has been around for a long time, where we scan different anatomical areas differently and then we compose them or we fuse them, and that is routinely done for spine. So also we can do it in, for example, very tall patients where it's not possible to get the entire femur at one time. We can do the scan in 2 stages and then compose the image to get a single image. And what has changed now is that we can do MRI much faster. So we can do abdomen MRI much easily as compared to what the scenario was earlier. And again, the homogeneity helps. The short axis length of the tunnel helps because the patient is much more comfortable. And of course, post-contrast imaging is also very easily done and very beautifully done. MRCP, where this is a case of chronic calcifying pancreatitis, where this horizontal segment of the pancreatic duct is so irregular and dilated. Again, the homogeneity of the magnetic field helps us to get this. And again, in areas like prostate, also we can do MRI. We can do MR spectroscopy for the prostate as well, and we can do dynamic contrast for the prostate. So in many anatomical areas, we have a set of investigations, like for example, plane scan, contrast, MR spectroscopy, and in contrast, we can do dynamic scan because that gives us a lot of information. And of course, this is a contrast enhanced MR angiography of both lower limbs. So let's just come over to the CT now. So what basically is the difference between CT and MR is obviously the CT is much more faster, although it has radiation. But if radiation was our concern, now we have a low radiation dose CT that helps us and that offers much lesser radiation to the patient. So what has been done now, the tube which is shown here as a circular part has been made more compact, and the detectors that are available are of a much higher quality. So effectively we can give almost 40% less radiation to all patients. So in a comparable multi-slice CT, if you are doing a CT of abdomen pelvis, for example, you are going to give 40% less radiation compared to another scanner. Now I assume that is definitely a great service for the patient. So here at the back side of the circle, we can see that the black area is a conventional detector which was always there, and now this is an ultra fast ceramic detector which is used in the CT. And this is actually a paper from Portugal where they have seen a series of patients and have concluded that there definitely is a 40% reduction in the radiation. So you are getting the same information, you are getting the same images at 40% less radiation to the patient. And at the same time, you are able to get very, very high resolution. Now again, these images are typically 0.5 millimeter of HRCT temporal bone. A CT angiogram showing the lower abdominal aorta and the renal artery on the right looks normal, but what do we see on the left side? The kidney is not well visualized, but instead of that there is calcification, because this is a chronic calcified small kidney and we can't really visualize the left renal artery. This is a CT IVU where we do a contrast scan, and then after 15 to 20 minutes we run a delayed image so that we can get the kidneys, ureters and bladders, and these are VRT images, that is volume render technique. So these are real to life images which can make us, we don't have to think much, whatever we see we can immediately make out the anatomy as well as the pathological anatomy. This is a horseshoe kidney. We can see that the two renal kidneys are joined by the isthmus at the inferior pole of the kidney, and both the moieties have a separate ureters. So of course in the 3D of the joints, it plays a very good role, because in acute trauma when you do a 3D CT, you can electronically subtract the bone which has no trauma and show the injured portion very, very well in different angulations, so that the operating surgeon can make out whether it's a comminuted fracture, how many fragments are there, and how the approach has to be. So I'm so thankful that you have heard me so patiently. So what is the take-home message? Because since now we are able to come out and actually attend seminars, life really feels so much normal that one can again speak in front of you. So the take-home message is that there is great equipment, but it is only great enough when you can do a good diagnosis for a patient. Because I remember an incident which was around 5-6 years back, when there was this patient who had done 6 MRIs in the city of Mumbai, and then he landed up with us for an MRI, LS spine. He had done 6 LS spine MRIs in different places in Mumbai because he had severe lower limb pain, unable to sleep in the night. And we were doing an LS spine MRI, and incidentally when we screened the thighs, because we always screen the pelvis with both hips while doing an LS spine, so in the proximal thigh there was a signal, and my wife, Dr. Preeti, who is also a very excellent radiologist, she thought that there was something wrong there, so we should take some thin images. And when we took these thin images, we found that there was an osteoma there. And this patient went for a CT guided ablation, and he got cured of the pain. And then he came back to us, and it was very, very special that, patient has come back, because he was totally relieved. So there is great equipment, but the person who is handling the equipment should be committed and passionate about it. that every person who comes with a problem, there is a question which has to be answered, and until that is done, one has to think. That is the role of the radiologist. The radiologist has to think that what more can be done to give that answer so that the clinical problem can be solved. So we just saw that there is a difference in different 1.5 Tesla machines, because more the number of channels, you can do better, and we have seen that definitely resolution is important, because if you have good resolution, only then can you see the abnormality well, and only when you detect it can it be treated. So that is extremely important.